In perimenopause, it can be a bit more tricky because in those cases, women are still having their cycles and estradiol or estrogen production is not completely shut off. They are still making some progesterone. It may not be enough. And so they are still having symptoms, but they are not completely shut off where you can say, here is estrogen, do this every day, or here is progesterone, do that every day. Hi, I am Dr. Ruth Odoi. I'm the founder for Oasis Women's Functional Medicine. We are a boutique women's practice located here in Rochester, New York. Today I'm going to be discussing hormone replacement in perimenopause. Last week I did a video on hormone replacement in menopause. In that situation, it is clearly indicated there is loss of estrogen. We do tests and we are able to say you are in menopause, especially when women have not had a period for a whole year. That is when we say you are postmenopausal, and hormone replacement therapy is clearly indicated when they have certain conditions. Now, in perimenopause, it can be a bit more tricky because in those cases, women are still having their cycles and estradiol or estrogen production is not completely shut off. They are still making some progesterone. It may not be enough. And so they are still having symptoms, but they are not completely shut off where you can say, here is estrogen, do this every day, or here is progesterone, do that every day. So it becomes more tricky and nuanced, and they tend to have fluctuating levels of these hormones. And so when someone like that comes into my clinic and they are having symptoms and it's clearly indicated that they need some hormonal replacement, first is that we check hormone levels at different parts of their cycles to see where they are cycling, how these hormone levels are changing throughout the cycle. And then I also look at their symptoms to see if this is a progesterone issue, or this is an estrogen issue, or if this is a thyroid issue or cortisol issue. Usually these things do not act in isolation and they are not acting in silos. So we have to look at the whole picture to determine what kind of support a woman needs during perimenopause. And it's very personalized and it can be different from one woman to the other. The other challenge that women face during perimenopause is that because they are still having their cycles, they can still ovulate, they can still get pregnant. I'm sure you know a woman who has an 8-year-old and a 20-year-old. They had the 8-year-old not knowing, or they had the 8-year-old later in life sometimes, and it's usually during perimenopause where they did not think they could conceive, and then they did conceive. And so it can get tricky, and a lot of women during perimenopause are still on birth control, which adds another layer of complication because it's hard to really know where they are in their cycle. They are just having symptoms. And so we still try and check levels. We map it to your symptoms. We can sometimes do a urine test to see the breakdown of these hormones to determine where we need to be supported. But for almost every woman, I make sure that thyroid is completely functioning at the highest level. I check more thyroid tests than the average doctor would to make sure that your thyroid is really functioning well, because that can also affect your other hormones. The other thing we look at is cortisol to make sure you are not under chronic stress, which is then causing these changes in your hormonal balance. We look at your cortisol curve, and sometimes women need supplementation to support their cortisol so that the other hormone symptoms that they are having can be taken care of. Nutritional deficiencies can also make hormonal imbalances worse. And looking at your diet, looking at some vital nutrient levels to make sure that those are optimized. Lastly, we take it very seriously in my practice. We discuss sleep a lot here. Because if you are not sleeping well or you are not experiencing restful sleep, it can affect your circadian rhythm, and your circadian rhythm and release of these hormones are directly connected. Lastly, we look at stress. Stress management, your deep breathing, exercises, your lifestyle. Alcohol intake can also impact your hormones during perimenopause, as well as other drugs that you could be on for different conditions can come back and really influence your hormone levels during perimenopause. I say all this to say perimenopause can be very challenging because of all the reasons I mentioned above, but there's really a reason to think that, there's no hope and that there's nothing that can be done. There are so many strategies that we can implement to help support you during perimenopause, because this stage can last for 10 years for a lot of women. So there's really no reason for you to suffer through perimenopause because it's so complicated. I encourage you to make an appointment, see your doctor to discuss this in depth with them. We can also make a wellness consultation appointment where I can discuss some of these things with you directly. Thank you. I hope this was helpful. If you have any questions or comments, please put it in the comment section below. Be sure to subscribe and share this video with other women who are going through perimenopause with you. Thank you.